Amid Nigeria's persistent maternal health crisis, the Lagos Verbal and Social Autopsy Sample Registration System, LVASA SRS, is leading efforts to improve how maternal and perinatal deaths are tracked and understood in Lagos State. LVASA SRS was launched to provide reliable data on maternal and infant deaths, addressing long-standing gaps caused by weak registration and surveillance systems.
Childbirth is not supposed to be one that kills you. It's supposed to be something of joy and all that. So that's why it is very important that they're having this and they're disseminating the knowledge. They're handing over, this is what we have found, and then we can make decisions based as a government based on that. And also, part of what they're doing is part of our Lagos State's health agenda anyway. So they've targeted primary health care, the community, and all around the whole entire state of Lagos. So as you know, we're divided into districts. They went to all the 20 local governments, and then we're going to be able to know which local government has the highest, what do we need to do, how do we spend the limited resources that we have. And that's why it's very important that we take this very seriously, and we really thank them for doing it.
The investigators say the project employs verbal and social autopsy methods to examine medical causes as well as social and systemic factors that hinder timely access to care.
This method is one of the most rigorous methods, apart from actually counting, having a civil registration system where you have every single person numbered who dies. This is the next best method where you use a very accurate, statistically generated sample to determine the number of deaths so that you can be able to actually work on reducing those deaths. You cannot do or fix what you don't have data on.
We were not just counting, we were also seeking to understand the causes of those deaths. So we did what is called a social autopsy, where we spoke to the relatives of women who sadly lost their lives because of complications of pregnancy and childbirth, to hear from them, what was the journey to care like, to hear from health workers who provided care, to hear from traditional birth attendants who helped them within the community to understand what contributed to those deaths. And again, we are aggregating, and we have aggregated all those results, and we are now showcasing that as insights to the state government on how to move things forward.
As Lagos intensifies efforts to reduce maternal mortality, initiatives like LVASA SRS are proving essential in shifting the response from reactive measures to evidence-based action, ensuring that each maternal death is not only recorded and understood, but also used to drive meaningful solutions that save lives. Omobolanle Adeshui, Arise News, Lagos.